discussion. Dr. Keller, thanks for your time today.
Good afternoon, Morella. Nice to talk to you.
So this inflammatory illness in children, how different is it from Kawasaki syndrome?
Well, it's a confusing set of terms that are used to describe these things. So there is the Kawasaki syndrome, which is a condition that's not familiar to most people. And then there are variations on the theme of Kawasaki syndrome. There's a form of Kawasaki syndrome that is looks a lot like Kawasaki syndrome, but in addition, the children develop very severe shock. And that appears to be pretty similar to what some of these cases are that have been described. However, related to that off to the side, you have, and you just mentioned toxic shock. Toxic shock syndrome is another condition that can be caused by and triggered by multiple infections, just like Kawasaki can be triggered by multiple infections. And it can cause shock in children, as well as a rash and fever and some of the other systemic findings. There is a fair bit of overlap in these syndromes, Kawasaki disease with shock, toxic shock syndrome, and this new thing, pediatric multi-system inflammatory syndrome.
Okay, so we're talking about a situation here where kids are, we know kids aren't necessarily getting sick on a larger scale from COVID-19. That's what we've learned so far. But are the kids who are developing this inflammatory response, are they showing signs, typical signs of COVID-19, as opposed to kids who are asymptomatic and then developing into this inflammatory situation?
So far, that's not completely clear. It appears that some of the children that have presented, like in the information that was published from the United Kingdom, some of those children didn't have typical symptoms of COVID-19 before developing these. They had more intestinal symptoms, and with an upset stomach and perhaps vomiting or diarrhea. And that's the kind of thing that can happen with toxic shock as well. And so it doesn't seem that, as is the case with adults who get severely ill, start off with typical COVID symptoms and then become severely ill. It seems here that some of these children have something that doesn't look at all like COVID before this develops.
Okay. Can you give me an idea of what parents should watch for? Because you mentioned gastrointestinal, so stomach problems. What else?
Yeah, I think it's a thing that, as at any time, they should look for their children if they're different in any way that is alarming and persistent. And so, first, this is going to be younger children, children under the age of 5 for the most part, and children who develop a fever that persists. It's very common to develop a fever that lasts for a day or so. But if a child has a fever, and then with that, if they become lethargic, if they have other symptoms that are very noticeable and persistent, vomiting or diarrhea, or respiratory symptoms, any of those things that are persistent and worrisome would be reason to have a child seen and assessed, not just because of the concern that this could be triggered by COVID, but this rare condition could be triggered by some other infection as well.
And this inflammatory illness, do kids typically recover from it?
Well, so far it seems that they do. We've heard this news that has come out of New York saying that there's been 3 deaths in children who have developed this. There's not a lot of information on that yet. So far, overall, we know that very few children with definite COVID-19 disease will die, very, very few. And this is different, and it still seems, however, that the likelihood that you won't recover is very low, and the vast majority of children will recover. If it's Kawasaki-like, the vast, vast majority of children recover completely.
Okay, that is some good news. Dr. Jim Kellner, appreciate your time. Thank you for joining us today.
Thank you.